Hello, I am Dr. Mark Davis. I'm a naturopathic doctor and I'm a fellow of the American Board of Naturopathic Gastroenterology. I see patients via telemedicine at Foundational Medicine and Education, and we are so excited to announce the release of our first full-length course. This is 9 modules with over 10 hours of material, all about integrative care and self-care for people with inflammatory bowel disease. I released it with my colleagues here, Dr. Natalie Sheeler and Dr. Claudia Bustamante, and here are the 9 modules. I do a robust intro to IBD, the pathophysiology of it, the epidemiology of it, some interesting things about what we think causes it. Dr. Sheeler talks about labs and imaging, understanding how you get assessed for IBD. Dr. Bustamante, who's also a licensed nutritionist, talks about the many diets for IBD. And then we go on to talk about drugs, on-label drugs for IBD, off-label drugs, drugs to avoid. There's so many supplements. We pick out kind of our favorite, most evidence-based ones we like to use. There's a million herbs to use. Dr. Bustamante does a great job talking about those. And then microbial medicines, fecal transplant, probiotics, prebiotics. We talk about helminthic therapy, and we talk a lot about lifestyle for people with IBD. So that's the summary of the course. And I was inspired to some degree to go into medicine by this guy, Dr. Michael Nestor. This is my great-grandfather, and he graduated medical school in 1906 when things were very different. And I'm also so inspired by one of my favorite authors. This is one of the many books by Dr. Atul Gawande. And Dr. Gawande wrote this amazing article about cystic fibrosis and how outcomes changed from an average lifespan of 3 months 100 years ago to people routinely living into their 50s now. And that inspired me so much because that change happened because of people trying novel therapies and sharing about what their outcomes were. So all of the centers of excellence around the country could move care forward. And that's what we want to do with IBD. We want to move the care of IBD forward in amazing ways by treating our patients and offering courses like this, having people measure outcomes and sharing what we do with the world. So as part of the course, we talk a little bit about the history of medicine, and we talk about naturopathic medicine in particular. These are the pillars of naturopathic medicine. First, do no harm, treat the cause, treat the whole person, use the healing power of nature, teach your patients, and help prevent harms before they occur. And this is the naturopathic therapeutic order. Sometimes the highest force interventions, surgeries or drugs or even herbs that could have powerful side effects, sometimes those are needed. But every time we can, we start as low down on the order as we can to get the longest lasting good results. And that's what we encourage in general. We also talk about this idea of evidence-based medicine. The original authors who first published about this term, Sackett and Rosenberg, defined it as the overlap between 3 things: using the best available evidence, bringing in your own clinical acumen, your own experience and clinical expertise, and then take into account patient values, what is important to them. And then we also bring in this cube that we designed of a medical aesthetic. This amazing book inspired us, Your Medical Mind by Drew Grotman and Pamela Hartzband. And they talk about how everybody is somewhere on a spectrum between being interested in more natural interventions or more technological ones, between being a doubter and being a believer, and being a minimalist, you want to do the least number of things possible to get better, or a maximalist, you want to throw everything you can at it. And we added this extra spectrum here. Some people are cautious in what they want to try, and some people are bold in seeking benefits. So we talk about all of that in the course, and we talk a lot about science. This is the evidence pyramid, all the way from laboratory and animal studies at the bottom up to case reports. And then at the top, we give you lots of meta-analyses and randomized controlled trials of diets and herbs and important things to know about drugs, etc., for people with IBD. I also give you this fascinating analogy about a castle and some bakers and how the immune system sets things on fire in IBD. So the last thing I want to leave you with is this system that I came up with, and I call it the 5 steps of IBD care, and we apply it to every patient we work with. So step number 1 is make sure you're safe. There are times when people come to us and we tell them, really, you should not be outpatient. Like, you should go and be in a hospital where you can have immediate access to IV steroids or surgeons or things like that, because you are at risk of danger, of a really bad outcome. So making sure our patients are safe enough to be treated outpatient. Then we work to get them into clinical remission. That means no symptoms. But you can have no symptoms, but still be inflamed. And that's measurable in your blood, your serology, and also in your stool tests. So serological remission means that you have no symptoms and you're not showing any hyperinflammation in your blood and stool tests. And then the next step is histological remission, also called deep remission. And that means that biopsies of your intestines show no active inflammation. And that has a very good outcome. And after that, you move into maintenance, which is just checking those inflammatory markers a few times a year to catch early symptoms if they are going to be a canary in the coal mine. So as part of the making sure you're safe, we go through a bunch of red flags. And even if you're not sure if you want to take the course, I think it's important to know about those. So we made this IBD flare guide you can get for free at our website, which is foundational-medicine.com. And you can download that anytime. Just have a list of things that could help spur you to realize you might need urgent or emergency care. So thanks for taking the time to watch this, and hope you enjoy the course.